Let's examine why millions of Americans are increasingly turning to artificial intelligence for health guidance, a phenomenon that reveals as much about our healthcare system's failures as it does about technology's promises. The push factors are stark and deeply troubling. Healthcare costs in the United States are crushing. A single emergency room visit can cost thousands of dollars. Primary care appointments often require copays that strain budgets. For the uninsured or underinsured, even basic medical advice feels financially out of reach. Wait times compound the problem. Many Americans wait weeks or months for appointments with specialists, and even primary care visits often require scheduling days or weeks in advance. When you have a concerning symptom at midnight on a Tuesday, you can't wait 3 weeks for an appointment. Insurance gaps create another massive barrier. Millions of Americans lack health insurance entirely. Millions more have insurance with such high deductibles that they avoid using it except for catastrophic situations. They're paying premiums but can't afford to actually see doctors. For these individuals, free AI advice feels like the only accessible option. The pull factors are equally compelling. ChatGPT is available instantly, 24 hours a day. No scheduling, no transportation, no waiting room. You get responses in seconds rather than days. The conversational format feels natural and personal, unlike cold medical websites with lists of symptoms. There's complete anonymity. You can ask embarrassing questions without facing judgment from a human. Demographic patterns are revealing. Younger, tech-savvy users adopt AI health tools readily because they're comfortable with technology and often lack established relationships with primary care doctors. But older adults with mobility limitations or transportation barriers are increasingly using these tools too. They can't easily get to appointments, and AI provides information they'd otherwise struggle to access. The perceived accuracy is problematic. Many users assume that because AI sounds confident and provides detailed responses, the information must be correct. The technology's conversational sophistication creates false confidence in its medical reliability. The downstream effects are complex and concerning. On one hand, AI is reducing unnecessary primary care visits for truly minor issues. Someone with a simple cold might use AI to confirm they just need rest rather than scheduling an appointment. This frees up medical system capacity. But on the other hand, and this is critical, AI use is delaying diagnosis of serious conditions. People are getting reassurance from AI when they actually need immediate medical attention. Someone having subtle heart attack symptoms might be told their chest tightness is probably anxiety. Someone with early cancer symptoms might be reassured it's likely nothing serious. These delays can be fatal. There's also the problem of altered health-seeking behavior. When people become accustomed to free, instant AI advice, the barriers to actually seeing a doctor feel even higher. Why pay hundreds of dollars and wait weeks when AI will answer immediately for free? This creates a two-tier system where affluent people still see doctors while everyone else makes do with AI. From a policy perspective, this trend demands urgent response. We need to improve telehealth coverage so that real medical advice is more accessible and affordable. We need public health campaigns with clear guidance about safe AI use, explaining what AI can and cannot do, when to trust it, and when to seek human care immediately. We need to acknowledge that mass adoption of AI for health advice is a symptom of healthcare system failure, not a solution to it.